Mumbai.
Hello and welcome to Health Live at Seniors Today. Over the years, over the last 3.5 years that we've been conducting these Health Live sessions, we have invited a lot of specialists, a lot of medical experts on a variety of areas. We have also had psychologists, psychoanalysts who have been here on this session, but we've never really dealt with this issue of addiction. Yeah. And today, we've invited Mr. Vikram Kirtikar, who's a senior psychologist and outreach associate at Empower, the center in Mumbai. And the objective of inviting him is to invite him to discuss dealing with tobacco and alcohol addictions. Now, Mr. Kirtikar has been with Empower for around 6 years and has rich experience in the field of psychology, which includes working with diverse populations ranging from geriatric to adolescents. He has experience in academic setups and professional practice as a psychologist. Working with the elderly and understanding their unique needs has interested Mr. Kirtikar and provided that space to nurture that interest has been his endeavor. His areas of expertise include cognitive behavioral therapy, rational emotive cognitive behavioral therapy, and behavioral therapy. He is well versed with online psychotherapy, and he has received formal training and certification in promotive intervention module for the youth in positive psychology from Nimmans, which is in Bengaluru. He has also undergone formal training in RECBT, basic and advanced from In Vivo Institute of RECBT. He has experience in conducting workshops on various topics in various setups. And he believes that the ease of access to mental health care is everyone's right and strives in providing it. Welcome once again to Health Live at Seniors Today.
Thank you. Thank you.
Good
evening, everyone.
Before I invite you to make your presentation and say a few things about you make your opening remarks, we have a lot of people consider addiction as a lifestyle concern, right? And how much of it is a lifestyle concern and or a medical issue? Is it a medical issue or is it a lifestyle issue, or both?
So it is a bit of both. Okay. There is a medical aspect, which we call a biological aspect, and then there is something about how we are experiencing our life, in our everyday life. Okay. That also can, be a contributing factor to the use of substance. Right? Okay. So I don't know if that answers your question now clearly, but as we go further, maybe it'll give you more clarity on that.
No, absolutely. So over to you, Vikram, for the presentation. And those of you who have questions, please put them in the Q&A tab. Given the nature of the topic that we are discussing, if you would like to stay anonymous, you could do that. In case you don't know how to turn anonymous over here, as in this session today, we will not take the names of anybody who asks questions. So please feel free to ask your questions, something about your near and dear ones. We are dealing with essentially tobacco, which is smoking, and various forms of tobacco chewing, and alcohol today. Of course, there are several addictions, including cell phone addiction, games, etc., that one gets addicted to these days. But today we are discussing alcohol and tobacco. Over to you, Mr. Kirtikar.
Thank you. Okay, so firstly, as it goes, tobacco and alcohol addiction. Okay, in technical terms, what we mental health professionals refer to it as is substance. Okay, so let's first try and understand what substance is. Okay, to put it in very simple words, substance is anything that can alter chemicals in the brain. Okay, anything that is consumed that is having some kind of alteration capacity with the chemicals in the brain, due to which then we experience the intoxication of the substance. Okay, now again, there are different forms of use, okay, in substance, and the severity changes. Okay, to put it in simple words, one is using substance. Okay, that means if we had to talk about alcohol, uh, drinking socially, or once in 2 3 months. Okay, that is use. Okay, then we have something known as harmful use. Okay, which is consuming substance more often than not. Maybe it's a weekly, or once in 2 weeks, or twice in a week, or more than 2 times in a week. So that's harmful use. Okay, also, what we have to look at is when someone's consuming or indulging in the substance. Okay, what is the quantity like? Okay, so for example, if someone's consuming 1 glass of alcohol, okay, I'm not going to name any specific alcohol, but 1 glass of alcohol, and is stopping over there. Okay, it is definitely use. Okay, but it may not be harmful. Okay, however, if that 1 glass is an everyday thing, it can be considered as harmful use. Okay, sometimes in one evening, okay, there can be several number of glasses, and that could be considered as harmful use. Okay, so that's how we try to understand what kind of consumption is there, of alcohol. Or even if, let's say, we had to do smoking, you know once a month, once in 6 months, it's still use. Okay, harmful use would be in that once in 6 months, if the person is maybe having 8 10 back to back, then it's harmful use. Okay, so we understand that. Then the next form is dependence. Okay, wherein the person is feels the need to consume, either have tobacco in some form, or alcohol, and it's if they don't. Okay, it is something that it bothers them. Okay, and then it bothers them in the form of something we call as withdrawal symptoms. Okay, where they may feel uneasy, they may experience some physiological symptoms, like tremors in the hands, or excessive sweating, or excessive anxiety, heart rate increasing. There can be several forms of withdrawal. Okay, but then that is definitely a very alarming stage. Okay, of the use of substance. Yeah. Okay, now I am going to share one small video. Okay, which will help us understand the use of the tobacco, alcohol as substance. Basically, I'm going to refer to it as substance. Okay, and let's have a look at that video. So, if y'all were able to see that video, okay, y'all, if you all were seeing that initially, the first time when the bird, has that yellow thing, consumes that yellow thing, um, the bird feels elevated, nice, it lasts also for a very long time. Okay. But if you see, as the bird consumes more and more, okay, that feeling of elation is short-lived. Okay. But if you see, it has had an impact on the bird's body, right? And this is how substance actually works on anyone's system, okay, regardless of the age. Okay. uh, what happens is over a period of time, you start needing more of it. And that's where use may become harmful use, and which may end up into dependence, and the person may experience withdrawal. Okay. Mm. However, there is another aspect which is also important about any form of substance like tobacco or alcohol. Okay, that the substance itself plays an active role in creating the addiction. Okay, so what happens is when the person consumes the substance, it is doing something, it's altering the chemical process in the brain, the electrochemical process in the brain artificially. It is artificially inducing some change in the conscious awareness. Okay. Now what happens is when the use frequency increases, okay, the person will feel the craving when they don't get it. And what happens is over a period of time, the brain observes that this is being repeated. This feeling is being liked. So maybe this is a normal feeling, or this is what the person wants. Okay, and then it starts craving more of the substance. So that is a very important part to know about substance. Okay. If we had to quickly look into the types of substances, already two are mentioned. There is tobacco, which can be in the form of I'm going to use some colloquial terms like bidi, tambaku, gutka, pan, mishri, cigarettes, cigars. There are so many different forms of it. Okay, consumed through smoking, through eating, and so many different forms. Okay, then alcohol. I don't even need to say the names. Okay, but we already are aware. Okay, so again, tobacco. Okay, leading cause of coronary heart diseases. Alcohol, leading cause of diabetes. Okay. Then there are some other forms of substance which I would like to mention over here. Okay. One being cannabis. Okay. Which unfortunately is something that we do see a lot of people, consuming. Cannabis is in form of smoking. The words that they will use is like a joint, a J. Okay, or it can also be in the form of something that maybe culturally also recognized. Okay, which we call bhang. Okay, that is also a form of cannabis. Okay, um, then you have again, addiction can be also to a prescription medication. Okay, because there's ease of access if there's a prescription. Okay, anything related to painkillers, things like that. And then there are other hard drugs. Okay, which we won't uh, talk much in detail about. Okay, but there are a lot of other hard drugs which can have really bad impacts on the physical and mental health. Okay, just a few things to know here. Many of us believe that alcohol, say, liver sclerosis hoga, fatty liver hoga, okay, but accidents and death due to accident come in the top five reasons, okay, of dying, okay, when someone's under the influence of alcohol. Possibility of antisocial behavior, of getting into fights, leading to injury or death is also observed when someone under intoxication of alcohol. Okay. Um, then I would just want to cover a specific area here, that is of the geriatric population, the old age population, where there is long term dependence, on any form of substance. So smoking may have been for several years, or consuming alcohol may have been for several years. Okay. um, and also it okay, so we need to understand one thing over here. that our body is our brain and our body is very self-sustaining. It knows how to take care of itself. Okay, but what happens is, over a period of time as we age, okay, um how do we come to know that we are aging? Okay, because man say so we are yet young. Okay, our body tells us, you know. A simple example would be is, let's say, in a young age we were consuming junk food. Hmm? The time that our body took to process it and digest it, कुछ फर्क ही नहीं, in teenage कुछ पता ही नहीं चलता था. But as we grow older, we experience it takes time, or we may have a stomach upset. Okay, or let's say if we have done some workout, okay, or we have walked a lot, okay, the time it takes for us to stop feeling tired increases as we age. Okay, or pains, niggles, naggles come up, as we age. Okay, so also similarly, when substance is consumed, okay, the body does take time, to deal with it, especially alcohol. It does take time, okay, and it can have adverse effects on, uh, the health, overall health of the person. Okay. Now there can be several factors for, substance use. Okay, so emotional distress being a very important aspect. There's definitely something that the person is trying to cope with. Okay, and the way that they're coping with it is through either smoking or drinking alcohol. Not the most adaptive way, definitely a maladaptive way of coping, but it is a coping. Okay, and we just have to try to understand what it is that's, making them consume more of this substance. Okay, in more elderly people, losing loved ones, maybe a partner, friends, people we once knew. Okay, sometimes the feeling of loneliness, okay, can also lead to consumption of alcohol or smoking. Okay, lack of a peer group or friend circle, sometimes not feeling understood. Coming to terms, again, this is again with elderly people, coming to terms with one's own mortality. mm, um, then cognitive dysfunction or decline in the elderly. Okay, um, increase, in symptoms of already existing mental health conditions. Okay, and here I would like to bring in a point that, uh, medicine that a doctor prescribes is regulated because it's prescribed medicine. Okay, substance is unregulated. No one's really monitoring what and how much is being consumed, and that can be very dangerous or harmful to the person. Okay. Um, Sometimes, there are movie references also, which talk about, someone having a mental health condition, someone having a lot of stress and anxiety. um, they smoke a cigarette and they feel, for that moment, they feel a little more relaxed. It's a very small window where they're feeling like that. It's just basically the intoxication, and the nicotine is playing a trick with their brain. But that is also happens. Okay. um, and again, symptoms of other health conditions, masking the use of substance. So the person may complain of pain in the stomach. Okay, and use of substance may be completely ignored. Okay, that because of, consumption of alcohol, maybe that stomach pain is arising. So these are a few things that uh, are contributing factors. Okay. um, okay, so if you had to quickly look into the aspects of treatment. Okay. uh, Medication, yes, it definitely plays a role in treatment. Okay, the doctors can tell you better, the psychiatrists can tell you better. Okay, counseling and therapy plays a major role. Okay, so again, there may be a question that may pop up. What is What works? Is it medicine or is it counseling? Okay. Both complement each other. Okay. The medicine, helps the brain in just, managing till a time where the substance is not present, and therapy helps the brain learn ways of, coping with the distress. Let it be emotional, okay, or let it even be something biological, certain lifestyle changes, and implementing them. Therapy helps in that way. Okay. um, Building and understanding an environment that is understanding rather than reprimanding. So most of the times, it's very unfortunate, that we have come used to seeing, if someone's consuming substance, unka kya galti hai. We are always looking out for that. Probably we need to understand what is contributing to them, you know choosing this option as a substance. Okay. They also know it is harming them, but yet if they are indulging it, then there must be something, no. And what we can do to help them after understanding that. The more we reprimand, the chances are that that may lead to additional distress and more consumption of substance. Okay, alcohol, cigarette smoking. Okay, building a peer system. Okay, now when we're saying building a peer system, a system that discourages substance use, encourages non-substance specifically, okay, and encourages other forms of activity to, deal with everyday distress, having someone to talk to share with, okay, and engagement and activity, things like engagement, like it can be just looking forward to meeting someone at the garden, at the park. It may be that 30-minute conversation with someone, looking forward to that. That can deter someone from consuming any form of substance, right? So these are the few things, that can be worked into. But yes, definitely, extensive therapy, hmm, can help in the long run, such that even beyond the therapy, once the therapy is over, okay, the person can manage well, without the use of substance. So yeah, that's a little bit about what I wanted to talk about today, about today's topic. Thank you.
Thank you very much. Thank you very much for your presentation. I think very detailed. And now I have a few questions that have come in,
Sure.
and some have been coming from via chat. But here's one.
Mm,
Says that a close relative of mine had a problem with his son, uh,
mhm,
who is also above 60, and
mm,
he visited his doctor for
mm,
help, and the doctor wasn't able to help him. So, in case there's a problem like this, like addiction, who
mm.
does one visit first?
Okay, nice question. Um, okay, again, there is no what do you say, set professional as such that I can say that you have to visit. Okay, but mostly in our Indian context, it's the family doctor, who most people are comfortable, visiting. That's the first. Okay, and then that family doctor can further guide you, to maybe a psychiatrist, or a psychologist. Okay, the other two professionals, looking at it purely from a mental health perspective, are either a psychologist or a psychiatrist. The route can be different, but the point which we are reaching to is the same. Okay, so connecting with one of these, they can definitely help.
Just for the benefit of our readers here, all those who are here, what is the difference between a psychiatrist and a
Yeah,
psychologist?
very, very nice question, very common question. A psychiatrist is a doctor, an MBBS and MD psychiatry doctor who is able to prescribe medicine. Okay, a psychologist would have done their minimum masters in psychology, that is either master of arts or master of science, depending on which part of the country they have done it from. Okay, and they normally do therapy, psychotherapy or counseling जिसको बोलते हैं, scientific counseling.
And you know, who does one go to first? Does one go to a psychologist or a psychiatrist? Because what you're saying is a psychiatrist is a psychologist plus a doctor, and a psychologist is just a therapist, but will not prescribe medicines.
Okay, so firstly, a psychiatrist, their specialization is in medication, brain biology. Okay, some psychiatrists have learned therapy, so they may do therapy as well. Okay, but a psychologist is the expert when it comes to psychotherapy. Okay. There are psychiatrists who only prescribe medication. Okay. But psychiatrists and psychologists work together. So, for example, if you approach a psychiatrist, they may prescribe medication, but they may also refer you to a psychologist for counseling. And let's say if you approach a psychologist, they may tell you कि yes, there are concerns. They may refer you to a psychiatrist to check if medication is required. But they will also tell you that इसके साथ therapy also will be helpful.
So just as you see, you look for an MBBS with a doctor, what are the kind of qualifications one should look for from a psychologist?
Psychologist. Okay. So minimum they should have completed their masters in psychology. Okay. So I'll tell you that's they do their bachelor's in entire psychology and masters 2 years full time in psychology. Then there are some who may have also done MPhil who are called as clinical psychologists. Okay, so they also do assessment, that is psychological assessment. Okay, and so masters is minimum.
So fine, that's what it is, and I think it's good that we've clarified this because it helps people know, especially in an issue like addiction, who should one go to. We have a question from Shamla Ravi who asks, after stopping substances, how long does it take for a person to become totally addiction free?
Okay. Firstly, let me tell you that I can't give you a set time because each human, okay, each individual is unique. Okay. From a biological perspective, their body composition and their brain composition is very unique. Okay. So there is no set time, but depending on what kind of treatment they are going in for, so if there is medicine support plus there is therapy, okay, anywhere between 8 to 10, 12 months, okay, you can look into. But again, you have to also see factors. Let's say in the middle there is a lapse, let's say there is some form of use again, then that can extend the time. Okay, but if it's to the T and everything is followed proper, 8 to 12 months approximately, the person should be able to manage.
There's another question which has come again from an anonymous attendee who asks, how should caregivers take care of themselves when you are dealing with somebody who has addiction at home?
Very nice question, and let me tell you this, caregivers across health concerns do face a lot of stress while going about the process of caregiving, but particularly with patients of mental health, okay, and substance, there's a different degree of challenges that come along with caregiving over there. Okay, so to put it simply here, one is that whatever the patient is saying to you, Okay, see, understand one thing, that when someone is in that state of mind where they're craving the substance, okay, they may say a lot of things, do a lot of things just to get access to that substance. You need to understand that this is a person who is not well. Okay. A lot of times it may seem like the person is doing something intentionally. Yes, they're doing it intentionally, but not to hurt you. They're just doing it to procure the substance. Okay. So, first and foremost, we have to remind ourselves not to take anything personally. Okay. Easier said than done. Okay. Second, okay, the process of treatment has to be followed to the T. Okay, there has to be no gap in that, because the more you're going to follow it to the T, the faster the person will recover, and the less distress you have to deal with. Okay, and third, which I tell most of the caregivers that I come across, okay, if you feel that there is something that is bothering you a lot, it's going beyond your subjective capacity, whatever you think your capacity is, it is always a good idea to speak to a psychologist, a psychotherapist for yourself as well. Hmm. It will be a different psychologist from the one who is treating the family member who is having the substance use concerns. Okay, but it is very helpful to connect with another psychologist for yourself, to just keep yourself in a sound state of mind to manage the situation. एरोप्लेन में बैठते तो दे से नो कृपया पहले अपना ऑक्सीजन मास्क पहने फिर दूसरों की सहायता करें. So it's the same thing. When you are in a state of mind to manage that, you will be dealing with it in a better way, more effective way.
Thank you. We have another question,
Yeah.
which is taking Nicotex or Nicorette
Hmm.
is helpful in controlling tobacco addiction. What are the side effects of these medicines?
Okay. So, when it comes to medicine, see, I am a psychologist, so I wouldn't have much knowledge and expertise about the medicine and their chemical compositions. Okay. I would encourage you to approach any psychiatrist. Okay. And they would be able to answer that question with much more clarity on this.
But is it still, do these have side effects? Do these medicines have side effects?
Uh, I haven't come across any such case where there's a side effect of these alternate supplements, as we call them, supplementaries to the actual cigarette. Okay, but again, I won't be able to comment on that. Not my place of expertise.
Absolutely. So those of you who are here, as always, as we mentioned, please consult uh, a medical doctor, in this case, a psychiatrist, for assistance on medicines, and don't just take it because you've heard that it's something that should be had.
I would just like to add something over there. I made a point earlier, that is regulated and unregulated. Okay, it is always a good idea to speak to the professional. Okay, get complete clarity, ask all your questions, get all your apprehensions cleared. Okay, trouble the professional, please. Okay, with your questions, and once you have clarity, only then proceed ahead.
Thank you. Thank you. Very well said. Um, Doctor, this is the question which is there. Although this session is about addiction of for senior citizens, and I presume it is for addiction issues that are concern senior citizens, but a lot of senior citizens have non-senior family members who have addictions. What should a senior citizen do if her or his family member who's not a senior has an addiction, and how does one take care of oneself?
Okay, so I think this question, the answer to this question is two parts, because I'm seeing two questions over here. Okay, one is what can they do to help the family member, and number two is what can they do to take care of themselves, right? Okay. So number one, what can they do to help the family member? They can guide the family member to the right professional. हम्म, ओके। एज हिंदी में कहावत है, घोड़े को पानी तक लेके जाना वो हम कर सकते हैं, ओके, बट पानी पीने का काम घोड़े का है, ओके। सो वी कैन, द मैक्स वी कैन डू इज take them to the right professional and always keep on encouraging them, to follow up, and follow the process, the treatment process, okay. What one can do to take care of themselves, okay, well, that would honestly depend on what kind of difficulties they are experiencing. Okay. In scenarios where it has just got to do with getting the person to the right professional, convincing them to get to the right professional, then it would be more of subtle nudging, encouragement, you know, in a scenario where the person does experience some physical distress, letting them know that, maybe you can speak to the professional and see what they have to say. You don't really need to completely follow. Just at least, no harm in exploring. Okay. If it's more serious things like, maybe the person under the influence of the substance is getting aggressive, okay, that's when you need to have some kind of a support system ready. Okay. Anyway, for senior citizens, I would be very clear about this, that a support system always helps. Okay. It can be of people of the same age group, it can be younger people, but some form of support system, SOS system, something that they can reach out to in times of need, okay, is helpful. In a situation where, maybe there is some kind of a threat to them, then again, reaching out to that peer group, that support group, and finding help over there to get the person. Again, we are not reprimanding the person. We have to understand that the person is under the influence of some substance and the behavior is happening. It is to get the person to the right help.
Great. Thank you very much for for all your advice. I have just one question to one request to you.
Yeah.
There are hosts of us over here, those of you, those who are watching here. There is a bit of a stigma attached to approaching a psychologist, right? Because,
Mhm.
and especially amongst seniors here, because while the youngsters, they're those who are between say 15 to 30, they are still used to counselors in their offices, in their study institutions, etc. But older folks do not think of mental health as somebody who's mental, right?
Mm.
A word of advice to everybody over here who's watching and who's not watching and perhaps will watch later is what is your word of advice to people who and ask them to not be too concerned about the stigma attached to approaching a mental health thing, but it's important to approach one.
Okay. That's a very relevant question, and I will just like to clarify one thing. I am a psychologist, so I am trained, hard-codedly trained not to give advice, but I will give a perspective over here. Okay, and maybe you can make sense of it. Okay. So um, I'm going to talk about therapy. Okay, psychotherapy. Psychotherapy focuses on 3Ds. Okay, 3D movie, so 3Ds. Okay, what are the 3Ds? Okay, there is disorder, there is distress, and then there is development. Okay, disorder means mental health concern, मतलब mental disorder, illness. Okay, distress is emotional distress. It need not necessarily be a illness, but it can be emotional distress that we experience day in and day out. Most of us humans, in fact, all of us, me being a mental health professional, even I experience distress day in and day out. So that's number two. And number three is development, where there is no illness, there is no emotional distress, but there are certain things that we are doing. We just want to see if we can, do it more effectively or, understand it better. Okay. Something like communication, how can we work on it? Can you understand more about it? Okay, so this is overall what therapy covers. Okay, so the 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 thought, that मैं क्यों जाऊं, आई एम गोइंग टू यूज दीज वर्ड्स, मैं क्यों पागल के डॉक्टर के पास जाऊं, मुझे क्या हुआ है? ओके, लेट मी बी वेरी क्लियर इन थिंग, आपको कुछ होने की जरूरत नहीं है, किसी को कुछ होने की जरूरत नहीं है टू विजिट अ साइकोलॉजिस्ट एंड जस्ट talking or having a conversation. Okay, it's as simple as you going for a haircut. Okay, it's exactly like that, you going to a psychologist. Okay, uh yes, I understand that, a lot of chatter around, oh, psychologist के पास जा रहे हैं, कुछ प्रॉब्लम होगा. Unfortunately, ये उनकी गलत फहमी है, and we can't do anything about others गलत फहमी. Okay, but given an opportunity, we can share this information with them, that what all therapy covers. Okay, so it will give us that opportunity to share this and reduce the stigma. Okay, but for you personally, I would just say this, think of it as just going and having that 45-minute conversation with someone, just a conversation, and just seeing what what you what comes up, what you learn. Is there something new that you come across? Just that, and you can approach a psychologist.
Very, very well said. I think these are the words that I wanted you to speak and give a perspective. Thank you very much, Mr. Vikram Kirtikar, for this session that you've had, and thank you to the team at Empower to having facilitated this. We will be back once again next Saturday at 5 p.m. for another session of Health Live at Seniors Today. This session, the edited video and a takeaway, will be up on the Seniors Today website on Monday. That is Monday the 18th. It will be up on the website, so you can have a look at it. Those of you who have missed the film or who have may have just got distracted while watching the film, please do that. And of course, listen to the words of, if I might say, wisdom, and correctly so, from Mr. Vikram Kirtikar. Before we leave, the latest issue of Seniors Today magazine is just out, and I'm going to ask the producer to show a video on that. And I must say here that we have a scoop, an exclusive interview for the first time. I don't know, in many years, and seniors would be familiar with the name, with the face. We have an exclusive interview with Tina Ambani. We have an exclusive interview with Tina Ambani. Never has, she may have spoken a bit here and there, when the art when the art exhibition was there off, and she was doing some other projects, but never ever really a freewheeling interview with. We've spoken to her, her family, etc. So, can you play the video? Technology. Where is the video? Feroz, are you there? Oh gosh. Feroz? Well, the only thing I can do is play the video on my phone, but we're not able to play the video right now, but we will ensure that it is there on the when this edited video is there on the site on Monday, and you can visit the website. You'll need to register to read the article, but it's here. All right. that is our March issue of Seniors Today. That is issue number 57, and it's available free of cost. You just need to register to read some of our content over there. And once again, you can pre-register for our health webinars as always, and also participate in the various events, infotaining events, if I might call them, information and entertainment that we have as part of our Evergreen Club. So you can participate in that as well. Just download the Evergreen Club app on your Android or Apple phone, so you can enjoy all of that. And once again, we thank you to Mr. Vikram Kirtikar for being here and answering all our questions that our people have asked. And